And then the local modalities. And it's important to be clear that we are talking here about the local modalities, because you will, as we'll see in a minute, sometimes you get what I call paradoxical modalities, where the local modality is one thing and the general modality is the opposite. And that is very interesting. When you get that often is a very good guide for prescribing. Ledum, for instance. Ledum, the joints are relieved by cold, and yet it is a cold person who doesn't like the cold. So that's what I call a paradoxical modality. Same thing you can sometimes get with pulsatilla. So important to be sure, to be clear that the patient understands that what you are asking is the local modalities. Is your joint made better by putting the frozen peas on it, or by putting it in warm water, or putting a hot pad on it? Important, I think, it's the patients obviously often don't understand that unless you make that quite clear to them. The weather modalities, cold and wet, hot and dry. Prediction. I mean, most people are worse when the weather's cold and wet. It's a pretty non-specific thing. It's not of great value. You will occasionally get the opposite, the ones who are worse in hot or dry weather. That can be interesting. And the prediction, the ones who know in their bones when it's going to rain. That is quite useful. 3 remedies, I think, really that you associate that with, which are causticum, dulcamara, and rhododendron. In fact, I have my own little rubric for dulcamara. Can't walk past the freezer cabins in the supermarket because it causes pain in the knees. I have seen patients who are really so sensitive to the cold that they really couldn't go, they really have to avoid the aisle with the freezers in it at the supermarket. Local temperature, we've mentioned. Local pressure, and again, maybe something you have to, observe or ask the patient about in a creative way. Bryonia is better from local pressure. If they've got, it's a good one for for me it's the routine remedy for wrist tendinitis, unless something is better indicated. And they will come, with a splint or with a wrist bandage up, because it helps a lot. If it's pain in the neck, they'll come wearing a collar, because that helps. If it's, if they've twisted their knee, they'll come with a bandage. Useful little distinction. With an acute knee, a footballer's knee or something like that, that's acute twisting of the knee. Bryonia will be better. The 2 remedies you would think of, first of all, I think, are bryonia and apis. Bryonia is better from bandaging it up. Apis would be worse. And exertion, Rustox, for instance, is relieved by moderate exertion. They're worse from too much exertion, but also worse from sitting still. Sepia, rather unusually, is better from vigorous exertion. Quite a useful little indication for sepia, I think perhaps not used often enough. There is actually now a recognized syndrome of exercise dependency. They're often, young women who've probably may still have or have had in the past eating disorders, and instead of having anorexia, they're now hooked on exercise. They have to go and work out in the gym, for 3 hours every day, and they're probably damaging their joints by they're overdoing it, but they feel terrible if they don't. And that, I've seen 2 or 3 cases of that, and I think they were all sepia. And then the precipitating factors. I tend to divide mental things into acute mental shock. In some of the old books you'll find a rubric for apis, jilted at the altar. I'm not sure that happens anymore. Probably in the language of the late 20th century it should be came home and found her husband in bed with another woman. But you get the idea. Some kind of acute mental shock. In practice, probably a sudden bereavement or some really a sudden mental shock. Actually, much more common in practice, I think, is the chronic mental stress, and very often they stay well, while the stress is on. When the stress is off is when they get ill, and you think perhaps of a woman who's been nursing, an elderly parent for a long time. Their mum dies or goes into a home, and they stay well while the stress is on. When mum dies or goes into a home, then they get ill, and you have a number of remedies for that. In this context, I would perhaps particularly think of causticum, sepia, natrum mur also, but I think causticum is the one in this particular context I would think of particularly. Other illnesses, never well since, quite a lot to be said there. I saw a young man in his early 30s with nasty aggressive rheumatoid. Gave a funny history. He'd been in Rhodes on holiday and came back with a really nasty sore throat, which did respond to amoxicillin or something prescribed by the GP, probably a strep throat. I gave him streptococcinum and he did very well. Others, for instance, Reiter's syndrome, true Reiter's syndrome with the urethritis, medorrhinum. post-rubella arthritis, not uncommon, usually resolves over a few months, but it can grumble on, in which case you would give rubella nosode. And in ankylosing spondylitis actually does well with homeopathy. Bowel nosodes are frequently indicated. And I don't know if you're aware, there's a little bit of history to that. Ankylosing spondylitis is related to the bowel flora. It has now been shown that if you take HLA-B27 positive people without ankylosing spondylitis and HLA-B27 positive people with ankylosing spondylitis and compare the bowel flora, you will find that the people who have the ankylosing spondylitis have a much higher proportion of cross-reacting antigens. They have antigens in their bowel flora, mostly in Klebsiellas, that actually cross-react with intervertebral disc. And this seems to be an important part of the pathogenesis of ankylosing spondylitis. And the homeopaths have been saying, in fact, since 1925, that the bowel flora can have an effect on chronic disease. The bowel flora actually also seems to be involved in rheumatoid arthritis. Not quite clear, the connection is not quite as clear. But certainly rheumatoid arthritis can be benefited by vegetarian diets, and vegetarian diets do cause changes in the bowel flora, and it is hypothesized that may have something to do with the fact that vegetarian diets do benefit it. But anyway, bowel nosodes, particularly for some reason Morgan-Gärtner, I find useful in ankylosing spondylitis. So that's your never well since. Obviously there may be others, but I think I've mentioned the common ones. And surgery, for instance, I've seen severe pain after hip replacements. Usually, routine hip replacements, as you know, good operation usually works well. But sometimes if it's been a complicated one or a revision or something, you look at the x-rays, it looks a horrible mess, a lot of callus and a lot of pain. That is something that responds often very well to symphytum. And then the systematic inquiry is useful. I find this particularly useful, in advanced cases. And unfortunately, we do see too many advanced cases. I get the rheumatoids, and they've tried everything else. Their hands like that, what we call teeth. Tried everything else. Try homeopathy. And they're very often it's rather flat, if you know what I mean. There's not a lot in the way of symptoms. They've got pain most of the time. It gets worse if they overdo it. It's worse when the weather's cold and wet, and that's about it. Not a lot to go on. And there it is very often helpful to look at the other problems, any other problems they may have, which will be less advanced and therefore less flat, will have more modalities, more features, and may give you a clue as to the right remedy to prescribe. And I simply work from the top downwards. You can do it any way you like, but it seems a logical way to do it. Headaches can be quite useful because although it's a vast rubric in the repertory, there are certain quite characteristic types of headaches. Bryonia, we'll talk about in a minute, has a typical kind of headache. Semicifugia has a typical kind of headache. Nux vomica, lachesis. Several remedies do have quite typical kinds of headaches. So that sometimes can be useful. Lachesis, a typical one, is left-sided, worse in the morning. The others, we'll talk about some of the others in a minute. Upper respiratory tract, again, you may get some nice little clue, pulsatilla, nux vomica, have quite characteristic kinds of catarrh. We'll talk about sepia. We'll talk about them in a moment. The chest, again, may get asthma. Costochondritis, quite a common thing, and for some reason often missed. I've got a number of patients who were convinced they were having heart attacks until I press on their costochondral junction. They jump. It's very easy to diagnose. But bryonia very often is the remedy, unless something, unless there's a good reason for prescribing something else. I would prescribe bryonia for costochondritis. Food desires and aversions, I think, are overplayed in general. I think especially people who are new to homeopathy tend to overplay them. And I think the reason is they're easy to deal with. There's a fairly limited number of foods, and you can, so they're fairly easy to remember which foods crave sweets, which foods, like acids, which foods are averse to fats, and so on. But they're of relatively little importance. I think, in the hierarchy of how much weight you should give in your prescribing, I would say really relatively little. And of course, then you have to be aware, you have to take into account what is rare, strange, and peculiar. For instance, these days, if you ask people, do you like fat? Nearly everybody says we grill everything, which isn't answering the question at all. But the thing is, I mean, people are so aware these days that saturated fat, is bad for you. That they avoid using fat, and it's very difficult to work out often, whether they're truly averse to fat or just got out of the habit of using it. So that's not of great value. On the other hand, you do have what I call the defiant fat lovers, the ones who like fat, who have to have their fried breakfast every morning, love a bag of chips, and don't care if it's supposed to be bad for them. Sulfur, nitric acid, nux vomica, I think, are the main ones there, the sort of the fat lovers who don't care that it's bad for you. And the one or two others, craving acids. Craving acidy things is rather unusual. Anybody like to give me 3 remedies that crave acids? Sepia? Don't think so. Yes, but vinegar and the ones who sort of drink out of the pickle bottle. Heap ourselves. And one other, which is actually a rheumatic remedy, neglected rheumatic remedy actually, ant crude. Ant crude, tend to think of it for skins, but it's quite a useful one for rheumatic problems, particularly in the hands and feet. I put the mentals last, not because I think they're the least important, but because by this time you'll have been talking to the patient for 20 or 30 minutes, and hopefully you've established some kind of rapport. And they may be prepared to spit it out, what's really bugging them. And of course it varies with the patients. I mean, at this stage the sepia patients probably still won't be prepared to spit it out, whereas the simicifuges or the lacuses will be letting it hang out from the first moment you talk to them. But as a general rule, I think it makes sense to come round to the mentals at the end. And the first thing is, reaction to illness. Have they got depressed? And if so, how? Or anxious? Or not? I mean, the sulfurs, one of the things you'll notice with sulfur, you say, well, I'd be depressed if I was as sick as that. But they're not. They remain surprisingly cheerful sometimes, the sulfurs. Others, get depressed. And of course there is the thing of what I call it, not what they say, but how they say it. And sepia, very characteristic thing with sepia, is, they really give a very strong impression of being depressed, and yet they'll deny it. They'll say, they'll deny being depressed, and you sort of having to drag the history out of them. They answer in a monotone and a monosyllable, and that is, of course, in repertory language, averse to consolation. They don't like talking about it, and they resent you probing, and they will deny it just because they don't want to talk about it. Have they got anxious, and if so, in what way? This sort of free-floating anxiety you get with certain remedies such as calc carb. They worry about anything and everything. They pick up tiny little things that aren't really their problem at all and then niggle over them. Arsenicum, that can have quite sort of fixed worries about, have they turned off their gas taps and that sort of thing. Irrational fears. You'll be familiar with the phosphorus fear of, the dark and so on. Silica, very important remedy. Actually, I haven't got it in this set of slides, unfortunately. I really must put it in. Very important remedy, very good remedy for inflammatory or arthropathies, and has a fear of needles. They really don't like having their blood taken. Very characteristic of silica. And then the specific mentals, tidy or untidy. I mean, some people don't like to admit to being untidy. They may be prepared to admit, however, to organized chaos. Perhaps a slightly more polite way of putting it. Assertive or gives in, irritable or weepy. Libido, I think an important thing to ask about, probably under, our books being rather Victorian in tone, probably don't deal with that, the sexual aspects enough, especially in women. I think they assumed that women didn't have libido, and certainly male doctors didn't ask them about it. But there are remedies, obviously, with low libido, sepia, phosphoric acid, and with high libido, phosphorus, Staphylos agria, picric acid. So I think it's certainly something worth asking about. And then time, and again, important to distinguish between time in general and time of the locals. I mean, in an inflammatory arthropathy, it is typical to be stiff in the mornings. And the opposite may count as a rare, strange and peculiar. It's certainly of interest. With degenerative problems, they tend to be worse at the end of the day. That's the locals. But the generals may be different. Lacusis is bad in the morning, nux vomica is bad in the morning, phosphorus is good in the morning. On a general level now we're talking. Lycopodium, as you know, has a typical afternoon, after lunch, or 4 to 8 aggravation. And then again, temperature in general, and as we've mentioned already, important to distinguish that from the local thing, because you can get them going in opposite directions. Sleep, how do they sleep, what's the pattern, sweat, and so on.